We're going to discuss glide of the distal femur as it relates to knee movement and knee pain. My client is a yoga instructor, and she asked me to take a look at her knee. Can you tell me about your knee?
My knee sometimes does a little clicking, and because of my right hip, which I think is, we've been talking about a little bit, I favor that left knee, especially going upstairs, and it's been painful. And it sometimes gets inflamed.
Okay.
And sometimes I feel like if I bend it or something, it will do it, like go like this or something, it will sometimes click.
Uh-huh. Does it feel tighter?
It doesn't, not tighter compared to the right side.
Okay, okay,
Sometimes it does feel a little tight, but compared to my right side, it
okay.
almost feels like I have to flex it more.
Yes, I agree. We measured that, and it does flex more. Okay. Now your patella doesn't have much lateral movement, in contrast with the right one. The distal femur appears to be more anterior, and I have more ease of getting my fingers behind the knee in contrast with this side. And if I come above the patella and I load and spring this femur, I can load it, spring it, and it recoils. This one, I can't load it. It's lost glide. Okay.
And this was the slide at one point that I had the cyst.
Yeah, she had a big
cyst.
Baker cyst, correct. Now, her left knee.
And sometimes when let's say I would sit with my butt on my heels, sometimes this side would hurt.
Okay, alrighty. I cannot hyperextend this knee. It's stuck in slight flexion and slight glide. When you bend your knee, there is a forward glide of the femur on the tibia. And when you straighten it out, it's the opposite. Her right knee, I can lift that heel an inch up off the tibia. Okay, so I want to treat her and restore anterior glide. And I did passively measure her flexion, and I got about 3 fingers between the heel and the back. We did this side, and I had my whole hand. And she knows she has greater flexion on the left knee. Okay, so what I like to do is prop the lower leg. I use these foam blocks. I put one under just above the ankle, and then I like to put one here. But what I don't like is that's putting her in a little bit more flexion. So instead of that, I'm going to fold up a hand towel. It won't be as tall. And I don't want to increase your knee flexion when I'm trying to basically restore extension. Okay? So I have this folded towel, and then I put it under proximal tibia. And so I come right above the patella, and my intent is to glide it towards the floor, and I'm putting at least 40 pounds of force into pure anterior to posterior glide. And that's a necessary movement with extension, especially terminal extension. Okay? And I like to do this for at least 3 minutes. For the purpose of our filming, I'm only going to do it. I'm only going to do it for about 1.5 minutes. And somewhere this knee had a trauma, and the passive force exceeded the joint's ability to dissipate, translate that force. And it induced primarily an anterior glide with a little bit of flexion. Of course, they're combined movements. But I would submit that the gliding is oftentimes ignored. I think if you look on YouTube for videos on restoration of glide at the knee joint, I don't think you're going to find much. But if you look for flexion and extension of the knee, I think you'll find a whole lot more. So anyway, I'm going to come off of that now. All right? And the first test I'm going to do is the patella. Look at that movement. Isn't that beautiful? Okay. and I wasn't able to get that load. There's your load. There's your spring, and it recoils. Now let's look at extension. I'm pulling, I can extend that knee, and I'm getting, I'm getting.
Plus the knees closer to
You notice that?
Oh, totally. Yeah.
Beautiful, beautiful,
Even more than this side.
beautiful. All right, let's have you walk down the hall and come back and tell us how you feel. You know, that's a simple treatment. It's a simple eval. It's a simple treatment. A little bit of effort to develop the skill set.
Oh, it feels much better.
It feels much better?
Yeah, I even went up the stair, like a few stairs.
Oh,
'cause That
good.
was where I would grip in my hamstring,
Okay.
and it was not gripping there.
It was not doing what?
It wasn't gripping because of my right hip,
Yeah.
which is
Yeah.
hurting. I was favoring this leg standing up, and I had been feeling like almost like a pulling in my hamstring
Uh-huh.
when I would push off.
Yep.
But because this has changed, this isn't taking all of the
Beautiful.
stress. You know?
Sweet.
Yeah.
I don't think you need to worry about it. I think that every time you walk, it's going to find a new range.
Okay.
Like Frank Lowen said, the body likes correction.
Mm-hmm.
If it's done correctly, it should be once and done.
Good.
So I'll bet you, if I see you again in 3 months, I'll bet you that's still there.
Yeah.
Okay. So thanks very much. I appreciate it.
Thank you.